Hello, welcome to my YouTube channel. Good evening, good morning, good afternoon, depending on your time zone. Okay, so this is Onye's Fertility Corner. Welcome to my YouTube channel. If you've not subscribed, please subscribe. Do well to subscribe, okay? I'm going to be dropping enough tips on health and wellness. Okay, so there's something I discovered that I want to share with you guys. I discovered something and I want to share it with you guys. The secret to unblocking fallopian tubes. You know that fallopian tubes are two tiny tubes that are attached to the uterus. They are in between the ovaries and the uterus. Now they pick up egg from the ovary, okay, and then the sperm gets into the body through the cervix, gets to the fallopian tube. Fertilization takes place there, and then the fetus, or rather the zygote now goes down from the fallopian tubes to the womb, yes, and implants. Now, if your tubes are blocked, it's impossible for you to get pregnant naturally, except through IVF. And then things that can block fallopian tubes are ectopic pregnancy, infection, previous surgery. Let's say maybe you've had surgery before and then you had scar tissues. It could block your fallopian tubes. If you've had a history of ectopic pregnancy, it could even block your fallopian tubes. It could lead to tubal blockage. Maybe you had infection, gonorrhea, staph, syphilis. You didn't treat it properly. It could lead to fallopian tube blockage. Okay. Now, the doctors, anytime your tubes are blocked, the next thing is go and do IVF. Save up money and go for IVF. And I started asking myself, I said, is it that once your fallopian tubes are blocked, automatically you've become barren? You've become infertile, like you can never conceive in your life except through IVF. Isn't there a remedy to unblock tubes? I kept asking myself. Then I started researching. I searched and searched and searched and searched. I couldn't come up with any reasonable thing on the internet. Now one day I went to YouTube and started searching on how to unblock fallopian tubes naturally. I now saw a Chinese tea. And then I read about the Chinese tea and I read reviews. Oh my God, the reviews were mind-blowing. So I said, okay, no problem. Let's try it. The Chinese teas are Yimu cow and Zhejian cow. I don't know whether I'm pronouncing it very well. These are the Chinese teas. This is Zhejian cow. I don't know. Okay. And Yimu cow. These two Chinese teas. Zhejian cow and Yimu cow. This is it. Now, they help to unblock fallopian. In fact, not they help. If you say they help, it's more like it assists. It unblocks fallopian tube. And not just that, it shrinks fibroid. Hey God. This one, they call it motherwort and St. Paul's wort in English. This one is the mother of fertility. In fact, it's the mother that mothered their mother. If you have fibroid, you see this Chinese tea. If you have PCOS, if you have, it's more like overall, even hormonal imbalance, it's overall. It's a Chinese tea. It's tea, okay? It's a herbal tea. It has spoon inside. It has spoon inside. This is how it comes. Even if you don't even have blocked tubes, even if you don't have blocked tubes, but maybe you're having issues with conceiving and you don't know what the problem is. You've gone to the hospital and they've told you unexplained infection. You could take these teas. But if you're taking it, don't take it with blood thinner. There's something they call blood thinner. Any drug like aspirin that thins blood. If you're taking blood thinner, you stop it for some time, then take this tea, then continue. Okay, you don't take it together. Now this is how it looks. It comes with a spoon. If you've had ovarian cyst, if you've had fibroid, PCOS, please order this Chinese tea. And blocked tubes, unexplained infertility, order this Chinese tea. Look, this is how it comes. This is how it looks. Don't know what I'm getting a very good picture of it. It helps to unblock fallopian tubes. Okay, so you take it with serapeptase. There's something called serapeptase. It's a proteolytic enzyme that eats scar tissue. Okay, so we have different types, but the recommended one is doctor's best. Doctor's best serapeptase. If you have blocked tubes, you take this together with serapeptase for blocked fallopian tubes. Give yourself, some women who took this stuff, if you can even take this one alone, if you don't want to take serapeptase, but people who used it to unblock their tubes took this and serapeptase together. Now you take serapeptase first thing in the morning on an empty stomach, then 1 hour later you eat. Some people said they react to serapeptase, blah 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 blah. If you don't feel comfortable, serapeptase is best taken on an empty stomach. Okay, it's not belly friendly. This one is belly friendly. So when you take serapeptase first thing in the morning, then after like 1 hour you can have your breakfast. But this one, you take it, you can eat after 20 minutes. All right, so people who use this to unblock their fallopian tubes took these two Chinese teas together with serapeptase. But if you have fibroid, you have PCOS, you've had ovarian cyst, you have maybe pelvic adhesion, you have scar tissues, you could take this. You could take this alone. But if you have blocked fallopian tubes and your tubes is as a result of infection, you have hydrosulfins, you have in fact, once your tubes are blocked, when you're taking it, it's advisable to take it with serapeptase. But even if you don't use serapeptase, it will still work. If you don't use serapeptase, it will still work. All right, now most women who took this thing had their fallopian tubes unblocked in 10 days. It depends on the blockage. They have distal blockage, they have proximal blockage. There is a blockage close to the ovary. Those ones are very hard. Then there's one close to the uterus. We have two types of blockage. We have the one close to the ovary, we have the one close to the uterus. The one close to the uterus is minimal. The blockage close to the ovary, that's the tubal blockage close to the ovary, is more intense. It's more is serious. It's more serious. So if you're taking this serapeptase, you can take it for like 2 months. For those who took theirs and their tubes unblocked in 10 days, most of them had the distal blockage, that's the blockage close to the uterus. But whichever way, just know that this thing works. If you have blocked fallopian tubes, IVF is not the only option. IVF, there is a way. Doctor tells you, there is no way. You cannot get pregnant. Your fibroid is not fibroiding. Blah, blah, blah. There is a way. See, this is Chinese tea. You take it on an empty stomach 2 to 3 times a day before food, 20 to 30 minutes after eating. You get hot water. You scoop one of this. This is Yimokao. You take 1 scoop of this, and you take 1 scoop of Zizienkao. I don't know if I'm getting the pronunciation. This is Zizienkao. You take 1 spoon of Zizienkao. You take 1 spoon of Yimokao. Okay, you put it in hot water and then you turn it and allow it for some time to dissolve. It comes in granules. Okay, you allow it for some time to dissolve, then you drink it. Some people put honey because they say the taste is bitter, but the taste is not. If you can take it, the taste is not. You can tolerate the taste. It's not bitter. Some people put honey inside it. You now turn it and you drink. Some women say they saw the blockages coming out. Some women that have fibroid even said after some time, the fibroid started they started spotting. Then after some time, the fibroid came out. As in, you will pass the tissue. Whatever that is blocking your tubes, whatever, if it's PCOS that you have, okay, PCOS, you may not pass the tissue. But if you have blocked tubes, if you have adhesion, you will see the tissue pass out when you're urinating. If it's fibroid that you have and you're taking this thing religiously, what it does, first of all, it starts to reduce the size. After some time, you just go toilet, you want peace, the thing will fall off. Seriously, this is very powerful. You can Google it, read about motherwort and St. Paul's wort. This is the mother of fertility. That's why it's called motherwort. This is the mother of fertility. IVF is not the only option, okay? Like I said earlier, some women had their tubes unblocked in 10 days. They took the tea 2 to 3 times a day. First thing in the morning before breakfast, they'll take it. 20 minutes later, they'll eat. When it's time for lunch, they'll take it again. 20 minutes or 30 minutes later, they'll eat. Then time for dinner, they'll take it again. In 10 days, they had their fallopian tubes unblocked and they got pregnant. There was even a lady that I was researching that said she took her 7 days. After 7 days, she had her tubes unblocked. There was one that said that she was just taking it for fibroid because the fact she had a little fibroid, so she was trying to take it. She got pregnant. There's another one that said she had ovarian cyst. Listen, research this. This Chinese tea, you can get it on Amazon. You can get it on Gigi. There's that shopping app called Gigi. You can get it from Gigi. You could get Serapeptase too from Gigi. You could get Serapeptase from Amazon, and you can also get this from Gigi. For those who don't know how to use Amazon, you can get it from Gigi. It's about how much? 20-something thousand. Because of this dollar, I don't know how much it is currently, but this thing works. Ovarian cyst, PCOS, fibroid, and the mother of blocked fallopian tubes. This is it. This is it. This and Serapeptase. But trust me, even if you don't take Serapeptase with it, it will work. It will work. Go and do your research, all right? So this thing is very, 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 very good. It's the mother of fertility. If you're having issues with fertility, try this. Try this tea. There was a friend of mine that had hysterectomy or something. I can't remember what, but she took this. 2 months later, she conceived. It's going to wash your system. It's not like using when you're detoxing your system or when you're using something to cleanse your system. Okay, it's more like, I don't know how to put it. You know, a pipe that has cobweb. You know, fallopian tube is like a tube. You know, a pipe that has cobweb inside. If you get, if you apply pressure, if you put water inside the pipe, the whole cobweb inside that pipe will just, wash away. You get. Now, when you're taking this tea, be drinking enough water. Drink 2 to 3 liters of water. When you start taking a drink, as you're drinking, you will go to toilet to pee. You will see particles come out of you. This is for tubal blockage. Okay. Some people, 10 days, you're good. Some 1 month. Some 30 days. The highest I've seen was 6 months. The highest I've seen was 6 months. You can take 2 to 3 times a day. You can take it once a day. You can take it twice. If you want it to work well, you can take it twice a day. You can take it once a day. But it works. Okay, so give this a try and I would hear your testimonies. Thank you. Bye.